Marine injured his ankle on an assault course. On examination, he is severely swollen ankle as well as tenderness over the medial malleolus and also the proximal fibula. X-ray demonstrate medial malleolar fracture with spiral fracture of the proximal fibula and widening of the syndesmosis. What is the most appropriate definitive management? Here the findings are severely swollen ankle. That means there is a chance of fracture and also the tenderness over the medial malleolus and also the proximal fibula. And X-ray demonstrate that the medial malleolar fracture and also there is a fracture of the proximal fibula. That means 2-point fracture. One of them is the medial malleolus, which is the part of the tibia, and the proximal fibula. That means the two bones are fractured. That means one of them is the tibia, another one is fibula, and also the widening of the syndesmosis. That means there is displacement. So what may be the management? Here the options are surgical fixation, application of ankle foot, application of lower leg plaster cast, application of external fixator device, and below knee amputation. So first of all, let's see the different type of fracture in the ankle joint. Here we can see this is a classification which is a Dennis-Weber classification. It is Dennis-Weber classification. In Dennis-Weber classification, they are classified in the three types. So one of them is the type A, another one type B, another one type C. In case of type A, usually it is located below the syndesmosis. That the syndesmosis, that means it is a fibrous joint usually between the tibia and the fibula. This is the tibia and this is the fibula. So this is a syndesmosis or fibrous joint between the tibia and fibula. So below this syndesmosis, if there is fracture occurs, then it is the Dennis-Weber type A. And in case of B, it is located at the level of the syndesmosis. And in C, type C, it is located above the syndesmosis or above the B. So this figure also here, this is another very obvious, which is the A. That means which is below this fibrous joint between the tibia and the fibula. So below this syndesmosis, this is the Weber type, Dennis-Weber type A. The joint at the joint side is the Weber side B, and above the joint between the tibia and fibula, it is the Weber type C. And this type is very, very important because the management is totally different from A, B, and C. So first of all, let's see the Dennis-Weber. It is commonly used classification in case of the ankle joint fracture, and it is based on the fibular fracture in relation to the syndesmosis. So this is very, very important. It is related to the syndesmosis. What is syndesmosis? The syndesmosis is a fibrous joint between the tibia and fibula. This point, this is a fibrous joint between the tibia and fibula. This area, actually this area. More proximal, greater risk of syndesmotic injury and therefore fracture instability. So in case of fracture A, it occurs below the level of the syndesmosis. So below the level of the syndesmosis. And B, type B, that means the Dennis-Weber type B, it occurs at the level of the syndesmosis. And type C, it occurs above the level of the syndesmosis. And this includes the and also, so this three is very, very important. One is the Weber type A, B, and C. A occurs below the syndesmosis, C occurs above the syndesmosis, and the B usually at the level of the syndesmosis. Now the classification management of this classification, it is also important. The Weber type A, Weber type B, and Weber type C. C is the more upper part, A is the more lower part. The more lower, more conservative. The more upper, more surgical procedure. So in case of Dennis-Weber type A, what we can do? We can use only ankle boot. So using ankle boot is enough for management of the Weber type A. And in case of Weber type B, there is two options. One of them is the ankle boot, another one is the operative fixation. So when there is operative fixation, when there is displacement of the joint or displacement of the fracture segment, when the tibia fibula both are fractured, when there is the more displacement, in this condition operative fixation. And when ankle boot, when there is less injury, there is less displacement, there is fracture but which is usually in setting position, that means no displacement, in this condition ankle boot may be used, but most of the case the operative fixation is required. And in case of Weber type C, it is upper part, so it is compulsory operative fixation. So what is this type? In this patient, the X-ray demonstrates medial malleolar fracture and also the spiral fracture of the proximal fibula, and it occurs at the level of the syndesmosis. Here the widening of the syndesmosis, that means at the level of the syndesmosis. As this is widening, that means this is the displacement. There is the medial malleolar fracture, also the spiral fracture of proximal fibula, that means the two important bone fractures. So there is the huge bone fracture, there is displacement. So as it is the Weber type B classification, go for the surgical option. And application of the ankle boot may be used when there is less displacement or single bone injury. So in case of Weber type B, in this patient there is more injury, so we have to go for surgical fixation of the patient.